Good afternoon, everybody, and thank you for joining me on today's webinar. I hope you're all safe and well. My name is Ravi Jain, and I'm sure many of you have met me. Looking by the polls, you've all been here before, so that's wonderful. And welcome to this, several of our new uh, um, clients and people who are interested in finding out about fresh eyes. Hopefully, you find this webinar informative, and one day I'll get a chance to see you. Right. So let me introduce myself to you for those of you who have not met me before. I'm Dr. Ravi Jain. I'm a consultant aesthetic physician since 2006. So I'm a bit older than when this photo was taken. The main difference you can see here is that there's a lot less darkness in my beard, a lot more grey hairs of wisdom showing now. I used to be a GP on the NHS in Luton. And since 2008, I've been an educator in aesthetic medicine, lecturing in many countries around the world. I had the great opportunity to do that and speak to and teach thousands of healthcare professionals, doctors, dentists, surgeons, dermatologists, nurses. But what that brings to you as a patient or potential patient is that I've been able to draw on many other experts' experiences, because one of the benefits of being on the lecture circuit is that you learn from other experts, and not just in presentations, but when you're talking and mingling with them, and you've always got an expert in eyes, in noses, in eyebrows, in lips, in elbows, whatever part of the body, at the end of a phone for me. And we share our experiences all the time. So we increase our knowledge all the time. And what that means for you, I can pretty much reassure you that you will get the best advice when you come to Riverbanks, because that's integral to what we believe here at Riverbanks. We've won Best Clinic in the UK 4 times since 2009. I haven't entered the competitions for several years now. And our practitioners here are highly experienced, and really we all share the same value for you, which is really to follow the guidelines set by the General Medical Council, the GMC, of good medical practice. Your safety is paramount, and your best interests are an absolute priority to us. You will always receive honest advice backed by integrity, as well as expertise, knowledge and experience. So, please be reassured that, people sometimes ask me, are you a real doctor? Yes, I am. And based on those principles, I will treat you as a real patient. Okay, so let's get closer to the topic now of what we're here for. And I'm going to focus mainly on the eye area. As we age, you'll see in this schematic diagram that as we age, several things happen, and I'm just going to focus on the upper part of the face first. First of all, obviously thing you'll notice is there's increased wrinkling, okay, particularly above the brow, and the forehead, between the eyebrows, across the nose, and then around the sides of the eyes. Okay, these are caused by various things: chronic sun exposure and excessive use of the muscles in these areas. And I'll explain later how we'll address those. The other thing you'll notice may not be so obvious, but you'll see that there's a groove under the eye here. And this is caused by several things. In particular, in this instance, it's caused by a widening of the eye socket. If you look carefully above, between the nose and the eye, here it's much smoother, but here it's done deeper. So the actual eye socket itself actually gets bigger, but the eyeball stays the same size. So that means there's an increased hollowing around the eye itself, which lends itself to these features of a dropping of the eyebrow, heaviness of the eyelid, particularly the upper one, and also a hollowing around the lower part of the eye, also known as the tear trough. And what we're going to do today, I'm going to address how all of these features can be treated and improved with non-surgical treatments. Why are the eyes so important? Well, it was interesting. There's this study done in New York about 15 years ago at one of the universities of art. And what they wanted to do, they tracked individuals' eye movement when they looked at this picture. And what they noticed was that nearly every single person, first of all, started looking at the eye, okay? And then they moved down to the mouth. So what we get here is this central facial triangle. And why is this? Well, the reason we do this is because the eyes and the mouth are forms of communication. And that's what we do when we tend to stare at each other's faces. So the eyes are paramount. And this is why we're talking about eyes today, because in one of my newsletters, which I sent towards the second half of last year, I asked you all what were the topics you'd like me to talk about the most, and eye rejuvenation, without doubt, was the number one question. And so that's great, because I do that regularly, and we've got some simple options for you. Now, as I said, it's the most common area to be asked about and to be treated. And I summarized the main concerns here, which I hear about all the time. Tired eyes, people being accused of looking tired when they're not. The brow position, the brows become heavier, it's starting to drop, wrinkles around the eyes, and also sometimes people complain about the crepiness, the skin quality around the eyes, which can also include darkening of the tissues around the eyes as well. So we'll address those for you now. First of all, let's look at an anatomical diagram and work out what we're dealing with. So first of all, we did talk about the changes that happen when we get the eyebrows, the furrows and the forehead. This lateral part of the brow tends to drop. The eyes tend to narrow, the head caused by the heaviness of the upper eyelid. And what happens is the cheek fat pad tends to drop, which causes also the groove under the eye. These are the muscles involved. So for the forehead, if you look at myself, if I raise my eyes, raise my eyebrows, you can see I get these horizontal forehead lines. That is the muscle here. It's called the frontalis muscle. This is the muscle which is responsible for holding your eyebrows up. Now, there's a group of muscles called the corrugator muscles and the procerus muscle and the orbicularis muscles. And what these do, these pull the brow down. So when I contract those muscles, if you look at me, I'm pulling my eyebrows down. You can see that the really heavy brows come down. So my muscles are very active. Now, these two muscles are opposing each other. The frontalis, the forehead, is lifting, and the glabellar group of muscles is pulling down. They are constantly pulling against each other, even in a state of rest. As we get older, the balance between these muscles changes, and that's something which I'll address when I talk about brow position. So, tired eyes probably is the most frequent complaint in my practice when I hear patients say, I've been told by my workers, my children, my family, I'm looking tired. So the question is, are you actually tired? Because if, you may be tired because of young children, you may be tired because of work, you may be tired because of looking after elderly relatives, and it may be all of those combined. All right, you may have recovered from an illness. So if there are actual, reasons for the tiredness, we should really try to address those first, because every treatment will be the outcome will be suboptimal otherwise. First thing first is make sure you're hydrated, and that means with water, not with wine. Okay, so the first thing to do is make sure you're hydrated. Take 2 liters of water a day, please. And also try to get your sleep. Try not to stay up too late just out of habit. Try to get to bed early and try to get 8 hours a night if you can. They will make dramatic changes to your whole facial and bodily function, and how your limbs feel, how your joints feel, as well as how your face appears. And on top of that, your psychological well-being will improve dramatically. we've talked about the anatomical changes. So what I'm going to do here, one of the main reasons that causes a tiredness is a change in the fat pad structure, the shape of the orbit, as we talked about, and the ligament support. But I also need to address that sometimes the tiredness around the eyes could be caused by darkening of the skin. And that's pretty difficult to treat. But if that darkening is caused by some blood vessels, we might be able to address that with lasers. By the way, if anyone does have any questions, please ask them in the chat. I just want to check if everyone can hear me. I've had someone ask me that say they can't hear me. If so, please just, I'll carry on until I hear that you still can't hear me. Right, now, tear troughs. So in this lady here, you can see this is a very classical tear trough, quite severe, quite extended. This is also called the nasojugal junction in anatomical terms. And this is caused by a difference in fat pad volume distribution between the malar fat pad and another fat pad above it called the soothe. In this instance, she looks tired. And in this instance, I would use very carefully, I'd apply some products called dermal fillers, such as Restylane, into this area using a cannula. It's not a painful area, contrary to what you may think. I would say lips are probably the most painful area to have injected. This is probably the least painful area to have injected. It's very important to appreciate that perfection is not possible when treating this area. As we can see here, we can look for improvements, but not perfection. And the reason for this is because the gel, which we inject, does tend to expand a bit in the first few days after injection. So I need to anticipate that and make sure that we don't have an overcorrection. Sorry, I was getting distracted. Oh, I'll go back. There. The treatment takes about 15 minutes, and I tend to treat this over 2 sessions because the first session we tend to treat the deeper layer, and then the second session we just tend to just touch it up and tweak. So I do this over a month, 2 appointments a month apart, and each treatment will last in the first instance about 6 months, and then later the second treatment may last 6 months, it may last 12 months. It depends on the individual and how much of a correction was required. And finally, sometimes patients require 12 to 24 months between interval gaps, which is very good for them. What I find with these when treating this area is that many patients prefer to have, and you wouldn't believe it, but it's true, too much filler put in there as opposed to too little. And this doesn't fit in with good medical practice, and this doesn't fit in with my guideline, my aesthetics either. What it is that when we inject the area, several things will happen. First of all, I know you're going to puff up a little bit for a couple of days, maybe a week at most. Some people will hate that extra swelling they get, and when that swelling goes down, they are relieved. Some people love that swelling, and when it goes down, they're distressed and they want more. And some people get no swelling, and what you see is what you get. The important thing is to make sure that we have an anatomically correct correction rather than an extra swelling. Because some people get over obsessed with the slightest appearance of a groove, just like some people get over obsessed with the tiniest flicker of a muscle when they've had a botulinum toxin treatment. But don't worry, as long as you're aware of these potentials when you come and see me, usually patients are, we're aware of that now, and they accept my judgment. As I said, this is in your interests, and what you don't want is people talking about you behind your back saying what she had done or he had done. It's not just for women. There's this gentleman here, and this age group, sort of like 60s, is a very common age group for men to come in to have their eyes done, because for them the previous option was only eyelid surgery to remove this fat pad, this eye bag. But with careful use of fillers through 2 points, one here with a cannula another one there. So underneath the eye, we are able to create a nice softening of the outcome rather than infection. He's also had some skin boosters around the lower face to smoothen out the area, but I think the biggest change is the eyes. Again, here we'll see just a very small amount of Restylane here to soften the groove, corrected. As you can see, it's improved the shadowing caused by the pigmentation here. And we see a more rested and fresh look, like he's just been on holiday. And here's a lady who's had very similar. You'll see the crepiness of the skin, slight loss of volume below the eyelid. And we can see here nicely that she's had a pleasing result with dermal. She's also had some botulinum toxin to help correct these number 11 lines. And what you can see is that they're much softer here without any filling at all. So let's talk about brow position. Unfortunately, it's inevitable the brow's going to drop. That's what happens in life. It's what keeps a lot of eye surgeons in business. But what happened and why is that? Well, I've mentioned it earlier. It's due to the weakening of the muscles which lift the brow. So it's due to the weakening of the frontalis muscles, which cause the horizontal lines across your forehead. That is one of the reasons those horizontal lines become more pronounced with age, is because your body desperately trying to lift your eyebrows up so that you can see. It's also caused by a strengthening of the muscles which pull the brow down. So it's not only bad enough that your brows are dropping because the muscles are weak are lifting them up, the muscles which are pulling them down are getting stronger. And that's why people's frowns get stronger with age as well. So therefore, because we're dealing with muscular contraction, the best treatment to use is botulinum toxin injections to redress the balance between these two muscle groups. And the main aim is to help lift the brow. One wants to reduce the downward pull, so reduce the strength of the muscles between the brows, between the eyebrows, and that will cause a natural elevation. You can also use dermal fillers to help lift the tail of the brow if botulinum toxin isn't ideal. But I tend to always use botulinum toxin first and later supplement it with filler. Again, if we've waited a bit too long, we might find that the only treatment of really is a surgical correction called an brow lift, that you'd need to see a plastic surgeon for that. Wrinkles around the eyes, so the crow's feet typically, are caused by excessive and chronic overexpression of those muscles. So people who get those really tend to be people who smile an awful lot. Okay, so unfortunately, for being happier in life, you tend to get penalized with these lines around the eyes, but it's also due to chronic sun exposure, and it may have been overexposure to UV light in your teens and 20s, and it comes to haunt you now. The best way to treat these, again, because it generally is muscle contraction, and that's for the expressive cause, I would use botulinum toxin injections. But to treat the chronic skin damage that's developed, there's a treatment called laser skin resurfacing, which basically does give you brand new skin. If people don't want the downtime associated with laser skin resurfacing, we can reduce the wrinkles to a lesser degree with radiofrequency treatments, and I'll come on to those later. So here's a lady who had heaviness of the brow. You can see the tail of the brow quite heavy, sitting on her upper eyelids, excessive wrinkles, and this is not quite a smile, but just off a smile, okay? And you can see excessive wrinkling here. I placed botulinum toxin injections just in 3 or 4 points around the eye, mainly start on the tail of the brow. And what you'll see here, look at this fold here, in particular, the heaviness of the the hooding of the brow, that's lifted very nicely within about 3 weeks. Her brow shape has lifted, and she's got more room on between her lash and her brow itself. So this is very simple to do. There's no real pain associated with this, like plucking an eyebrow, these fine injections, and the effect starts to develop after about 3 or 4 days, builds up to after about 3 weeks, and these photos are taken about a month. This will last about 4 months, and then we repeat the exact same treatment. So it tends to be 3 times a year to get optimal results and natural looking results. Cost of a treatment like this would be £299. For just this treatment, this treatment here would be £250. If we treated the brow as well in the middle, that would be £299. Now, I mentioned earlier about skin quality, and as I said, the 2 options really were to improve the skin quality using the laser skin resurfacing or radiofrequency skin tightening, and the core is for the laser and the axis is for the skin radiofrequency. This is where the laser skin resurfacing really excels. The fine crepiness around the lower lid, okay, there's not really much volume loss, but the skin quality has deteriorated over years, and also you get some crepiness on the upper lid as well. It is the gold standard in skin rejuvenation on the face, including the eyelids. And on Real Self, which is a popular consumer website, it has an 85% worth it rating, not just for the eyes, but for the full face. Unfortunately, there is a downtime. You will have to hide at home for about 5 days with this treatment because your face will swell up and look red and potentially crusty. You look like a burns victim for a few days. So you can tell I'm not selling it, but I'm telling you as it is. It is painful, so we give you some local anesthetic. A treatment around the eyes it takes about 5 to 10 minutes, so it's not too long. And after the swelling's all settled down, the results will last 1 to 2 years, if not longer. Depending on which area, how many treatments you have. If you have just the lower lids, that treatment will cost about £500. But if you have the whole periorbital area, so the whole area of the eye, that will cost £1,500. And you can see how the skin quality has improved in this lady here. This is a swelling I'm talking about. So as I said, days 2 and 3, you'll see there's redness, little bit of crusting, and edema looks like she's lost a fight with Anthony Joshua. But this is 3 days later. So the redness, now the swelling has gone down, and the redness, you can see a level of pinkness around the eyes. Now this could last 2 or 3 weeks in some individuals, particularly in the fairer skinned people. But you can cover up with makeup after 5 days. There's another lady, very sun damaged Celtic skin, and we treated her with a laser. This was her at 2 weeks, 3 weeks post-treatment. You can see there's an element of pinkness still. Her skin's a bit dry. She hasn't been moisturized as much as she should have been, but you can see what a significant lift there is to her upper lid and also the smoothing of the skin on the lower lid. Men also have this, and we can see at 4 weeks, this is the treatment here, improvement in the lower lid. He has been hydrating well, and you can see an improvement overall in the lower lids and the upper lids. Ideally, he would need some dermal filler now to this area here, just to help reduce the widening of the eye socket. The final treatment really to talk about here is the axis radiofrequency treatment. Now, this is for people who really don't want any downtime and who are perhaps completely needle phobic, that not even botulinum toxin or dermal fillers are appropriate. So this uses a heat treatment. A hot probe is gently passed along the side of your eyes and around your eyelids and lower lids. And it feels quite hot, but not too painful. It feels like a hot stone massage. You get some immediate swelling, but it's like no more than going to a sauna, that sort of heat swelling. And results are very quick. You'll see results will start within a few days. We require once a week treatment for about 4 to 6 weeks, depending on how severe your condition is. And then we'd recommend a maintenance treatment of once a month. So depending on the packages you get, a 12 treatment package would be £1,200, for example. And we'd recommend that. And then after the first year, you'd probably reduce that to twice every 2 or 3 months for a treatment. So it ends up being not as cost effective as laser, for example, but there's no downtime, and that does suit a lot of people's lifestyles at the moment. So before I summarize, what would be good is if you can write some questions in the Q&A box, should be at the bottom or top of your screen, and I will try to address those. We've got about 1 or 2 minutes to go before, otherwise, if I don't see any questions, I'll bring the session to an end. But let's summarize. The main indications for treating eyes are tiredness, and the best way to treat tiredness usually is because of some fat. There's an impression of an eye bag or a groove below the eye. I would recommend using dermal fillers as a tear trough treatment. Wrinkles and brow position are often best treated with botulinum toxin every 4 months. And skin quality and some wrinkles can also be treated with the carbon dioxide laser. And that's about once every 2 or 3 years with downtime, or on a more regular basis with the Exilis skin tightening treatment on average after the initial course about once a month. Right. For those of you who've not been to see us before, just to let you know, you can get in touch with us. And for those of you who have seen us before, get in touch by replying to the email who I invited you to this webinar, and also to use our clinic app. For those of you who don't know, we're now taking all of our bookings via the Riverbanks app, which can be found on our website. It's much more convenient for our patients, and also how should I say, much more convenient, and also much quicker to get appointments rather than missing phone calls and email tennis as well. So I've got a few questions going on now. I'm going to go through those with you now. Right. Okay. Whoa. Okay. Okay. So tea and coffee does not count as part of the 2 litres of water. No, clean water, please, is best, really. Okay. The best treatments for mature skin, as I said, when we're treating with mature skin that has a longer exposure to the UV light, and also maybe more dehydrated and loss of collagen, really you're looking at a combination of a good intake of collagen and hyaluronic acid drinks, such as the Skin Aid range, as well as the CO2 laser, the core laser, to help to give you brand new skin around the area. That would be my recommendation for mature skin. There's a question which has come up quite frequently, is that are we doing any treatments during lockdown? Well, at the moment, no. We're only doing treatments with botulinum toxin if you feel it's important enough to you. Right? The current lockdown situation is pretty dire, and so we're just trying to be as safe as possible and minimise the duration of each appointment. And a botulinum toxin treatment is going to be reduced down to 15 minutes. And generally all that means is we're reducing our chit chat and perform the treatment as quickly and as safely as we can. Tear trough fillers, are they dangerous? Okay, really good question. I'm going to expand this. Are fillers dangerous? Are any of the treatments dangerous? So tear trough fillers are no more dangerous than injecting fillers on any other part of the face. So on the whole, they're incredibly safe. The complications with fillers are mainly to do with either where the filler can compress a blood vessel, or block a blood vessel, or there can be a skin reaction. Skin reactions are very rare. They do happen. We've only seen a handful of those in the last 12 to 14 years. Um, Thankfully, we've never blocked a blood vessel. So on the whole, I would say they're not dangerous per se, but difficult to get right in that area. It's very difficult to get right. And, you know, sometimes even I have to correct the work I've done myself because it's not as I would have liked it or the patient would have liked it. So good question, but no, they're not particularly dangerous in the right hands. Um, are hooded eyes mainly surgery? So really, I think if you've got really significant heaviness of the upper eyelid and the brow, you probably best bet is to consider a surgical solution. There's nothing non-surgical that can really make a big difference for those areas. So is the axillus every 2 to 3 months after 12 treatments? Really, it depends on your level of skin quality beforehand, but I would say after 12 treatments, you probably could get to maintenance of once every quarter. Absolutely. It's a matter of really just seeing how your skin responds. For upper eyelid skin laxity, again, I'd recommend either the CO2 laser or a surgical correction. And laser, the cost for laser on the eyelids would be in the region of about 12 to £1,500, depending on which package you go for. And I think I demonstrated some results we've experienced before that. So someone said they've had tear trough fillers at another clinic, but still feel they have dark circles. Again, that may depend on whether or not there's pigmentation or whether or not the correction's been enough. So what I would suggest you do, if you've ever had that, first of all, try to get the name of the filler you've had before, and then the name of the practitioner who treated you, and then come and see me and we'll go through that for you and to see if there's anything else that can be achieved or whether or not that's the most that could be achieved. All the injectable treatments are done by myself at the clinic for sure. Eye creams, best speak to Sonal about that. That's not my area of expertise. So we'll do that for you. And look, retinoids are the best creams for around the eyes, particularly isotretinoin. However, you have to apply it very, very sparingly and very, very carefully. And I would certainly say only under medical supervision. So, and what I mean by that is that you come and see me and I'll explain to you how to apply it and what to expect. Because there'll be a period of irritation on your eyelids for a few weeks before it gets better. Okay. So currently at the moment I'm here in Harpenden. My London practice is put on hold for the next 2 or 3 months. So we're safe here in Harpenden and I look forward to seeing all of you soon. Thank you oh, hang on. I hope I've addressed everyone. Yeah. Oh, sorry, there's a few questions I haven't addressed. Let's get here. There's a good question here about, does Profilo help with the injections around the eyes? Profilo has not been scientifically tested around the eyelids, and so I really can't help you with that. In anecdotal experience, we've seen some improvement, but to be fair, you're better off going for a treatment such as the CO2 laser or the Axillis to improve the skin around the eyelids. And just to remind you that I am going to be doing another webinar next Thursday at a similar time, and the topic will be on how I can lift those jowls for you. So if you have any questions you'd like to ask me, and make sure I include those in the webinar, please email those to me. But yeah, next week will be on jowl reduction or lifting. Thank you very much for your time today, and please stay safe, and I'll see you all next week. Bye-bye.